Hi, I'm Dr. Ivan. I want to talk to you today about tooth whitening your teeth. Today, it's no longer acceptable to have yellow, discolored, aged teeth. In today's modern environment, success, a better job, even attracting the opposite sex, all depends on how nice your smile looks. So, people are looking up whitening and tooth whitening procedures even more than ever. There's a lot of online searches for whitening. It's probably the most common cosmetic dentistry search there is. However, there's a lot of misinformation, and as you know, getting things online isn't always reliable or good. And I can assure you that in tooth whitening products, going online, you're taking a bit of a risk. There's some bad products out there, even shoe polish that people can buy to put on their teeth, and has caustic chemicals in it. Um, Even if it doesn't benefit us dentists, I will tell you that most dentists are honest people and they're going to tell you the truth. If there's an over the counter product that's good, we'll tell you about it. For instance, Crest White Strips Supreme is a great over the counter product. I wouldn't use it for myself because it's difficult to use. You create a lot of saliva, doesn't stay on your teeth well, but it's a very inexpensive product. It's about 45 bucks a box. It's great for kids. You know, there are some kids that just have really yellow, discolored teeth and can be bullied at school. And so Crest White Strips presents a really good over-the-counter product for these young people. For me personally, and for most adults who don't want to mess with that mess, customizable trays are the best. We have a new product from Ultradent that is a semi-customizable tray that has hydrogen peroxide up to 15%. That works decently. You got to be careful. It can burn your gums if you leave it in too long. About 20 minutes is the max. And we're experimenting with that right now. We're trying it on our patients and we're seeing how it works. I personally use a fully customizable hard custom tray for my teeth, and I use about a 35% solution at home, but I only use it for about an hour and a half. Beyond that, I'll have a lot of sensitivity on the next day. So you want to kind of judge what causes your sensitivity. Use it for an hour to start with. By the next day's afternoon, you can tell whether you have that zing or not. If you don't get a zing, go ahead and use it another day, but usually 2 days in a row, you're not going to get much whiter than that. Tooth whitening works great for a couple of shades, but don't expect to look like Halle Berry. Those are veneers. And veneers are the most dramatic way to have a whiter, more beautiful smile. You can align, straighten, make teeth look more youthful and newer. Crooked teeth can be straighter with veneers. So I love veneers. Veneers is what I believe in. I do a lot of veneers. I would put everybody on veneers who had any kind of distracting smile. But they're costly, and it takes a lot of experience and a lot of training for a cosmetic dentist to be good at it. There are a lot of amateurs out there. I can always tell an amateur job. I can tell a dentist who went to a weekend course and tried to do a set of veneers. The midline's crooked, the proportionality's not right. It may look slightly better to the patient, but when you're spending that kind of money, spend a little bit more money and get it done right by somebody who's had advanced sequential learning programs like Las Vegas Institute, the EEC here in Chicago. AACD accreditation is a very hard accreditation to get, and it proves that you've done some advanced training in veneers. These are irreversible procedures sometimes, so you want to make sure that they're done well, because you're going to have these on your teeth for the rest of your life. So have it done well, and especially if you have to have them redone in the future, you want to make sure you have a good substructure there for them to be redone in the future. The amateurs, I got to tell you, I've seen a lot of terrible work out there, and they actually give veneers a bad name because some people come back and go, oh, they look fake, or they look too big, or they're too white, and that's generally a dentist who did not learn all the proper materials and things to do veneers at a very high level. So I'm a big proponent of veneers done well. Whitening products are okay, but don't expect them to, make your teeth look super, white, that won't happen. They will just decrease some of the distraction that the yellows and grays that form on your teeth from wine, coffee, and tea will cause. Again, I hope that was useful. Let me know if there's a subject that you would like to know. Contact me at info@radiantedentalspa.com. That's radiantedentalspa.com. See ya.